Hello dear doctors and welcome again in Anatomy Student Zone with Dr. Saida Sara. Today I will cover pelvic brim, all questions related to that, how it's been asked in exam and what examiner expect from you regarding this topic. I will also cover what's the significance of this topic. Remember, if you want to understand this topic, you have to cover some concepts relating to this that I will tell you. As you know and already covered, the pelvic girdle is formed by two hip bones, sacrum along with coccyx. So anatomically, the pelvis is divided into two main parts, the greater pelvis and lesser pelvis. Do you know at which point we make the division of greater and lesser pelvis? Yes, it's pelvic brim that divides the pelvis into greater pelvis or false pelvis and the lesser pelvis or true pelvis. I will tell you later on why we name greater pelvis as in false pelvis and the lesser pelvis as in true pelvis. So it is also important to know about the pelvic brim, its anatomical landmarks. Remember, pelvic brim is ridge and this ridge is made up of bones. This bony ridge is present in the cavity of the pelvis, and as I told you, the pelvic brim marks the boundary between the true and the false pelvis. So it is not the standard part because as this is a bony ridge, so there are the 8 important fixed anatomical landmarks of the pelvic brim. For exam point of view, it's very important to remember that anatomical landmarks in a sequence wise. So look into this image and replay this part again and again so that you never forget these landmarks because they are very important. First is sacral promontory. As the name indicates, promontory, so it's the most prominent bulge, and this bulge is present on antero-superior part of body of first sacral vertebra. As you can see in this image, sacrum bone is shown and focus on the body of sacrum. Here on the body of first sacral vertebra, there is a bony prominence and we name this prominence as in sacral promontory, and this sacral promontory is present on the anterior and the superior part of body of the first sacral vertebra. So after the sacral promontory, there are the ala or the wing of sacrum. So the ala are the fan-shaped structures. They are laterally located and they are located on the base of the sacrum. So ala continues into a sacroiliac joint. And as you know, the sacroiliac joint connects the sacrum to that of hip bone. So the fourth point is iliopectineal line. Iliopectineal lines are the curvilinear line. As you can see how the curvilinear lines are having their shape in this image, and these lines run from the sacroiliac joint to the symphysis as shown. So point 5 is iliopectineal eminence, also known as the iliopubic eminence. As the name indicates, iliopubic means they are going to link two bones which are ilium and the pubic bone, but how we will see in upcoming images as well. Second, the eminence word is used and we know the eminence is a raised bony area. Now I will tell you the anatomical location of this eminence on a hip bone if the examiner asks you to specify this area. But before going into this, remember the hip bone is comprised of 3 bones which are ilium shown as red in this image, ischium shown as green, and the pubic that is shown as yellow. This is one-sided anterior view of a hip bone. Just focus on a pubic bone and we can see the pubic bone is having 2 rami. One is superior pubic ramus and the other is inferior pubic ramus. So the iliopubic eminence is present at a point where the body of the ilium and the superior pubic ramus, they make a union. As you can see in this image that is labeled as in point 5. Of course, it's quite understandable now that the word point 6 will be. It's a superior pubic ramus and the superior ramus of a pubic bone continues into a body of the pubis. If we more specify point 7, it's the upper and the inner part of body of pubic bone. And the last point is pubic symphysis, and again if I specify this point 8, it is the upper and the inner border of pubic symphysis. So the whole pubic symphysis is not taking part in a pelvic brim. It's just upper and the inner border of pubic symphysis. Remember, the anatomical sequence of all these points is very important for you regarding the exam point of view. If the examiner give you a command to describe one point on a pelvic brim, so I am pretty sure you can summarize that point, you can describe that point. So I will now summarize all these 8 points. So starting from point 1, sacral promontory, they continue into ala of sacrum, that are continuing into a sacroiliac joint. Then we are having iliopectineal lines. After that, there are iliopectineal eminence, which continue into a superior border of superior ramus of pubic bone, and it continues into upper inner border of body of pubis, and the last point is upper inner border of pubic symphysis. So remember, the pelvic brim or the pelvic inlet, it also demarcates the true and the false pelvis. So the greater or the false pelvis is all above the bony pelvis or the pelvic brim, and the lesser or the true pelvis is all pelvis that is below the pelvic brim. Now I will tell you an answer of another question that was left, why we name the lesser pelvis as in true pelvis. We name the lesser pelvis as in true pelvis because it is a true passage that forms the birth canal, and it is also contain the true pelvic viscera like uterus, prostate and the bladder. In exams, sometimes the images are also placed that can be the radiological image as well, and you have to identify the points that are labeled as 1, 2 or 3, or they can be labeled as A, B or a C. For this purpose, look into this image of an X-ray of a female pelvis. Here the marked dotted line is a pelvic inlet or a pelvic brim. We can also identify a sacroiliac joint on this image. Besides this, you can see superior pubic ramus and the pubic symphysis, and we have covered all these parts in a pelvic brim in a gross anatomy as well. At end, I will tell you about the clinical significance of this pelvic brim or pelvic inlet. When you will cover the ureters, you will see it faces the 3 normal constrictions, not a pathological one. So remember, these are the normal constriction and they are present as the ureter crosses through 3 points. And the one constriction among these 3 points is faced at a point where the ureter crosses the pelvic brim or a pelvic inlet, as you can see in this image. Another importance of pelvic brim is related with that of a psoas fascia. Now we will see what the psoas fascia is and where this psoas muscle is located. So focus on this complex but perfect image that will help you to understand this all topic. In this image, the lower abdominal region is focused. We can identify psoas major muscle, and this muscle is covered by means of an fascial covering that we named as an psoas fascia. So regarding pelvic brim, remember this fascia is attached to that of pelvic brim. Although besides the pelvic brim, it is also attached medially to a lumbar vertebrae as well. As all of you know, the common iliac artery divides into internal iliac artery and the external iliac artery. So have you ever thought what is the anatomical landmark where this division is going to take place? Yes, it's a pelvic brim. So each common iliac artery divides into internal and the external iliac artery at the level of pelvic brim. Now I will tell you another important point related to pelvic brim, and that point is that the ovarian arteries are also crossing the pelvic brim as they descend into a suspensory ligament of ovary. So there is a great clinical significance of a ureters and the ovarian arteries, as these both two structures, they are close to each other as they crosses the pelvic brim. So while doing ovarectomy, that is the removal of ovary, great care should be taken by our doctors regarding the ureters so that they can't be damaged when you are ligating the ovarian arteries in this procedure. So another clinical significance of pelvic brim is that of lumbosacral trunk. Lumbosacral trunk is located anatomically at or immediately superior to a pelvic brim, as you can also see in this image. So that was all about pelvic brim, important questions relating to that. And I am sure in exam, if you're going to face this topic, you will never feel difficulty. Thank you so much and thanks for watching. Keep subscribing and like this channel.